I now invite Dr. Mike Burrows to be presented for the degree of Doctor of the University, honoris causa.
Thank you. Oh, mask off. I can breathe. Vice-Chancellor, graduands, guests, I'm delighted to introduce our honorary graduate today, Dr. Mike Burrows, Coordination Director at the National Academic Health Science Network. I'm very proud to present Mike to you today on behalf of colleagues in the School of Health and Society. Mike is no stranger to the University of Salford and has been closely linked to the development and delivery of our strategic goals for many years. Mike has dedicated his career to the NHS for 33 years, originally a Doctor of Biochemistry with a PhD from the University of Manchester. Mike went on to work in a series of finance-based positions across the Northwest before moving into general management roles. An experienced chief executive, Mike led the Salford Teaching Primary Care Trust from 2004 to 2011. Under his leadership, the Salford PCT developed into one of the leading research active primary care trusts in the country. Mike was then appointed Chief Executive of Greater Manchester Primary Care Trust Cluster for 2 years to 2013. During this time, he was also the Director of NHS England Greater Manchester Area Team from 2012 to 2014. Subsequently, Mike became Managing Director of the Greater Manchester Academic Health Science Network before moving into his current role within the National Academic Health Science Network team. Here, Mike has responsibility for engaging the NHS, academia and industry to generate health and wealth, particularly through the adoption and diffusion of innovation and research output. He has an active interest in the use of evidence-based medicine and is a passionate believer in the benefits of stronger ties between the NHS, academia and industry. In this respect, he was one of the founding board members of the Manchester Academic Health Science Centre, MAHSC, where the University of Salford is also a strategic partner. The Centre's goal is to make new scientific discoveries and shorten the time to turn them into effective treatments, to deliver benefits to patients locally and around the world. MAHSC is one of the only 8 academic health science centres in England and the only one in the Northwest. Mike has undoubtedly made a hugely significant contribution to the advancement of healthcare within Greater Manchester and beyond, and he remains a significant strategic player in healthcare devolution agenda. He is a regular contributor to the Health Science Journal, chairs the Bury GP Federation, and is also a board member of a number of social enterprises and public-private partnership organisations. He is currently a non-exec director at Fusion 21, a social enterprise specialising in efficient and impactful public sector procurement through a framework approach, with social value at all of its heart and its operations. Together with all of Mike's professional achievements in public service, we are also delighted to honour his outstanding commitment to the university with this award. The University Council is our supreme governing body with responsibilities for strategic oversight of the Institute's activities, determining its future direction and ensuring compliance with its framework of governance. Mike served on the Council for nearly a decade, from 2009 to 2018. He was also Deputy Chairman and Pro-Chancellor from 2014 to 2019, and the lead member of Finance from 2009 until the end of his term of office. Despite his many other responsibilities during his time, Mike also took on the role of Chair of Council to help steer the university through a brief interim period. Over many years, Mike has helped shape the vision of the university into the future, steering the governance of the institution through some challenging and many successes. He has played a pivotal role in the continued development of our institutional culture and values, as well as embodying them wholeheartedly. He is unwavering in his commitment to students, staff, alumni and partners, and the awarding of the highest honour is surely an appropriate way to mark his service to the university. Furthermore, Mike's wider contribution to the region, his successful and inspirational leadership in the NHS, and his commitment to advancing healthcare research, innovation and collaboration for the benefit of society are all more than worthy of his celebration. He has a deservingly strong reputation locally, regionally and nationally, and he is an outstanding role model, demonstrating the transformative impact that career in healthcare can have on patient care and communities. I'm delighted, therefore, to present for the degree of Doctor of the University, Dr. Mike Burrows, in recognition of his outstanding leadership for our NHS, his support and service to the university, and his commitment to the people of Greater Manchester and beyond. Vice-Chancellor, I present for the degree of Doctor of University, Dr. Mike Burrows.
Vice-Chancellor, distinguished guests, fellow graduands, assembled guests, it's a great honour and a privilege to stand here today to receive this award. But I want to take you back to Friday the 3rd of March 1978. It's a cold, wet, rainy night as I remember. I just turned 15 at the time, and it's when I first came to the University of Salford, to this very hall to be precise. I travelled here from Middleton, where I lived then and continue to live now. I think I was stood just over there somewhere. And here on this stage, there was someone rather more glamorous than the people assembled here today, if they don't mind me saying so. I think it was just where the Vice-Chancellor was, because it was Debbie Harry from Blondie. Well, as you can imagine, the University of Salford made a great impression on me as an adolescent young man. I joined the NHS in 1986, and it was relatively early on in my career, in 1989, that I first started working alongside the University of Salford, and I was at Bolton Health Authority at the time. And I worked with the soon-to-be professor of the university, Mike Garrity, who I'm sure some colleagues here will remember. And he was leading the implementation of a piece of work called Project 2000 in Greater Manchester that was to transform nurse education and training. It was a move not without its critics, and at the time I think a lot was learned from the change process that we went through. And it brought about what I think is now a much more balanced approach to that such a rewarding career demands. And it taught me very early on in my healthcare career that academic institutions, and Salford in this particular case, play such an essential role in supporting the NHS and social care, and many of the other great UK industries, including the public sector, where the need for well-educated graduates is now one of the most pressing challenges of our time. I moved to Salford Primary Care Trust in 2002, where I became the Chief Executive in 2004. And it was whilst I was in this role that I was offered the fantastic opportunity to join the Council of the University, a position, as Margaret said, I fulfilled for 9 years. And I guess this is my second point comes in about the university, the importance of academic institutions in the civic life, the broader economy, the health and well-being of the towns and cities within which they stand. Within modern parlance, it's what we call the anchor institution. And I think the University of Salford is a real exemplar here, both in the way it's partnered and built trust, trusted relationships locally, and added value back to the city. A great example is how the university was one of the early anchor tenants in the development of Media City. A brave move at the time, not without its critics, but the success of Media City and the businesses it has attracted, the employment it's created in what was once a neglected area of the city is a fantastic example of what successful anchor institutions can do, and of which the university is undoubtedly a great role model. One further unique characteristic of the University of Salford, from its very early roots, is the recognition that the university has a part to play in the life of the city, not just as a tenant, but to actually contribute what makes Salford, Salford. More recently, I've become a director of the National Academic Health Science Network, whose mission is to identify promising innovation and accelerate its uptake into the NHS and social care. And my final point here is about academia and the NHS. It's not just about the supply of labour and graduates, it's about the supply of ideas, of research, of innovation and applied research to change the way that we deliver services for the future. And I'm very grateful for that in terms of the work the universities and the University of Salford undertakes. Finally, I'd like to address just a few comments to those of you who are here today and graduating. Firstly, can I say thank you for letting me share your graduation ceremony. After all, mine's an honorary degree. It's you guys who put the really hard work in. And so you've earned the privilege to be here today, so I'm grateful that you've shared your day with me. My advice to you would be to grasp the opportunity that you now have in front of you. I hope that most of you, if not all of you, will have fulfilling and rewarding careers in public service. I would say that, wouldn't I? And don't feel limited in terms of where that career takes you. Think big, because after all, I couldn't have dreamed back in 1978 when me, a scally from Middleton, would be stood here now today. So go for it. Thank you.